Yeah, so traditionally or essentially RT is practiced again is designed to create a shift within one session, and traditionally we don't limit the time of the meeting. It could take within, the session could take 30 minutes or it could take 3 hours. So we meet with a participant and we don't stop until we created the shift and this participant is satisfied. They no longer can, and how we check is if a person comes in and they can easily bring up the disturbing emotion related to an event that happened previously. At the end of the session, they cannot do it. For example, anger, they cannot trigger it. Fear, they cannot trigger it. They cannot bring it up anymore, right? So if they try really hard, then they cannot bring it up anymore. And usually we also suggest to do a follow-up session if something else needs to be cleared, some sort of, to my experience, sometimes I meet people only once with sometimes 2, sometimes 3 hours at a time. And then sometimes we have a follow-up session for an hour, maybe a week or two later, if there's something else we need to address. In traditional therapy here, I've adjusted to practice RT and hourly, and so people come in, we do RT initially hour at a time, clearing up a specific aspect or focusing on a specific aspect at a time. And then usually people really like the results and they want to keep coming back for supportive therapy, which I still use RT with them. Using RT concepts or perspective or ways of thinking, sometimes, and again, using the eyes closed processes. So I'll continue to use RT even within the framework of the traditional therapy, talk therapy. Yes.